Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release, ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. All right, William, tell me what's going on with your shoulder. What happened?
It's just progressively gotten worse and sore and now it's constant pain.
How long has this been going on?
6 months.
How did you hurt your shoulder?
I'm not sure.
Okay. So for the last 6 months, what kind of treatment you had for your shoulder before coming here?
Initially, I've got one of those home medic massage.
Those with the knobs?
The knobs that do
the vibration one?
Vibration and heat. Heating pad, ice, stretching, Advil,
medication,
turmeric,
supplements.
Yeah.
Did you have any treatment, physical therapy, chiropractor, or stuff?
I started going to a chiropractor 2 weeks ago. The middle back, I've seen relief there, but my shoulder and neck has not gotten better.
Okay. So how much pain do you feel in your shoulder and your neck from 0 to 10?
Without anything, when I wake up in the morning, I feel pretty good.
Okay.
And then I get up, I start moving around. Within an hour or two, if I don't take anything, it builds up to real bad. Sometimes a real hot shower, in combination with turmeric, or I used to take a leave, but then that worked. But then I heard that Advil is stronger and would be more effective, so I started taking that. A doctor had prescribed me tramadol a while back, and I had some, so I would take one tramadol.
Okay, with medication, how much pain do you feel, even with medication?
With everything, it can get down to maybe 1-2.
Okay. At worst, how much?
At worst, it's, oh my God, I need to
go to the ER?
Go to the ER.
Okay. What is difficult for you to do because this issue? Reaching, lifting, what kind of motion that aggravate your shoulder symptoms?
Almost anything, but
anything?
You
Can you do this?
Like
this side? Yeah. Can you see the difference between left and right? Make sure you get both. So where do you feel the pain?
Right here.
Okay. So this has been going on for 6 months, is limited like this.
Yeah.
Okay, can you go thumb up and both of them? So we're gonna get both so to see like full. Okay. You're very stiff. Why you are slow? Is it because of stiffness or pain?
I don't want it to hurt.
Yeah. So it's a little bit limited here. Let's do thumb up, and we're gonna do this motion and bring it up. So you can see the difference between this. You see the shakiness here? Your muscle very weak, and that's a limited range of motion. Can you bring it back? We'll have you stand up and bring it back. Turn around both of them and bring it back. So this is a good one. This is a bad one. So he's going a little bit. Yeah, it's almost the same, but it took him a while to get it. Okay. So with those motions, how much pain at worst, and which motion is the worst motion, pain-wise?
Which one was it? This one here.
That was the most painful?
Yeah.
Okay, how much and pain did you feel when you did that now?
It increased a little bit.
To how much? 0 to 10?
Well, now it's probably 5 or 6, and it probably went to 7.
In here.
I feel it even on both sides.
So we'll have you lie on your back. We're going to take a range of motion. Okay, and relax. So we're going to take the range of motion. I want to make sure you write this down, okay? So shoulder flexion. I want you to thumb up and bring it up and stop when you feel pain, okay? So shoulder flexion, I don't know how easy it is. You see how his arm is shaky? Is 140.
Okay.
140 shoulder flexion here. There you go. Let's see. There you go. Okay. No. It's 138 shoulder flexion. Okay. Abduction, it's gonna be from the top. Okay, stop when you feel pain.
Which way am I going?
Toward your ear. Okay. So shoulder abduction is 150.
150?
Yeah, abduction. Okay, we're gonna do internal rotation. Okay, just hold it here. So we're gonna be from this angle. Okay, bend, 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 bend. So this one, okay, 70, it's almost not normal. Okay, backward. That's fine, that's fine. Okay, so the limitation, abduction and flexion, those are the worst. So make sure it's not painful, okay? How does feel?
Fine.
Okay, bend your knees and relax. But you don't remember like a special episode you failed or you lifted something that really started that or made it worse?
You know, I think part of the trouble is like years ago when I hurt my back, I knew I could feel it move, but I had no pain. And then a day or two later it hurt, and then the next day I was fine. And then it was really, really sore after the
Your
third,
back or
fourth
your
day.
shoulder?
I'm talking about years ago, my lower back.
Okay.
And so I've noticed that sometimes when you hurt yourself, you have pain immediately, and other times you don't feel any pain until that 2 or 3 days later. And so you sometimes don't realize that you hurt yourself as bad as you thought. And when you're doing something every day.
Is there any pain here? Sorry to interrupt you.
No.
Do you feel pain with what I'm doing?
No.
Make sure you tell me, okay?
Yeah.
Okay. Go ahead.
So it's hard to it's hard to say what event
What
took place.
caused it?
Yeah.
Yeah. Okay. Feel this nod here. Is that too much what I'm doing here?
No. And I can feel it.
If you feel pressure, that's fine. But if you feel pain, make sure you let me know, okay?
Okay.
Because there's fine line between releasing and causing tightness. If you feel pain, that will cause more inflammation and gonna cause more scar tissue and tightness. So that's why
that's
we
a
want
little bit of pain that lasts a little bit.
we want to make sure that it's whatever we do is not painful, okay?
Okay.
And you said you're pain in the whole shoulder or just a certain part of it?
Well, there's between my shoulder blade and my spine, there's a big knot there.
In the back.
Yeah, on
Okay.
the back.
So I'm gonna get to this, but let me, while you are here, we'll work on the front. So
Okay.
you feel a scar tissue in between.
Yeah.
How long you been feeling that?
A while, but it's gotten worse.
Okay, that's before the 6 months. Before this is like
No,
or that's
Yeah.
during this time.
yeah.
Okay. Okay. Okay, it's gonna feel cold, okay?
Right.
I'm gonna work on the scar tissue. I will show you actually how scar tissue feels, okay? You feel this grinding here?
Yeah.
You feel that? That's a scar tissue.
Okay.
It should feel like nice and smooth like this. Feel how nice and smooth here?
Yeah.
Feel that grinding.
Yeah.
That's a scar tissue.
Huh.
So when you have a scar tissue like this, And actually, it's a very, you can visualize, we can visualize here, you see redness here, you see that redness?
Mm-hmm.
Right where there's scar tissue. So when you have a scar tissue, it's similar to, the muscle should act like a rubber band. When it contracts and relaxes, stretch like this. When you have a scar tissue, it's like you have a knot in a rubber band. So when your muscle contracts, it does not stretch much. And that's restrict range of motion.
Is that scar tissue, is it part of it collagen?
A scar tissue, it's hardening of the fibers of the, or it could be anywhere, the scar tissue. In the muscle, it's in the ligament, in the tendon, anywhere. So by definition, it's the technical name for it is fibrosis. By definition, fibrosis any tissue hardening.
Okay.
So you have it here that is hardening in the muscular area. It's usually connective tissue. So that's a scar tissue. It's a normal part of healing process. But the problem is, well, perfect scenario, the body should get rid of it. For example, if you lift something and you strain it, your body gonna build a scar tissue because you have a micro tear to heal it.
Mm-hmm.
If your body builds too much scar tissue, that's scar tissue in a way. And if your body does not dissolve it, so that will cause restrictions, limiting the range of motion of the joint. And you feel a little bit here. You feel that here?
Mm-hmm.
That grinding. So you have it here. If we don't know like a specific accident, you lift something that was heavy and you had like pain afterward, it's usually over time from repetitive strain injury, like overdoing it.
Yeah.
Or poor posture doing it for a very long time.
Yeah.
So it's either or. If we don't know the exact history, it's usually over time from repetitive strain injury or repetitive bad mechanics. Does that make sense?
Yeah.
And you can see, you feel that?
Yeah.
I feel like a little rock in here, and I can see the tool is going there. And you you're very intuitive to your body, you feel that knot in the back.
Yeah.
But if you feel it there, my gut is telling me it's probably going to be bigger than this one. Because if you start to feel it, usually it's too much.
Yeah.
You know, not as small on this. And I will show it to you in the back actually when you have you turn to the back. So what I have you to do, okay, how does that feel?
Okay.
Okay. Make sure that's not painful, okay?
Yeah.
Okay. Let me do this. Okay. You can go back a little bit, yeah. No, I mean like away so I don't have to. Is this a knot you're talking about or here?
No, it's down lower.
In here? I feel several one of them.
Oh yeah, it's all over.
You have several of them. It's not. I just feel it. How does it feel?
All right.
Okay, see how big is that scar tissue? Sure. Yeah, you get a big scar tissue here in your traps and here. Is this the one you're talking about here? In this area?
Yep.
Okay.
Yep, right there.
And here.
Yeah, that's the magic one.
Yeah, that's a big one here too. It's right on the edge of your scapula. Is that how you feel like it's not going further when you lift it up? because it could be from this scar tissue in this area. It's not allowing your shoulder blade
It definitely doesn't
to
allow
move.
me to move my arm
to move around.
across.
Yeah. And I can see, like, you saw here, like the redness, it's just a spot here and a spot here
Mm-hmm.
when we started. This is the whole thing.
Mm-hmm.
So it's like really widespread, the scar tissue, and here. So that's another way we determine how big is the scar tissue. Is it a thickness? You feel this knot? Okay.
Mm-hmm.
And the width actually of the scar tissue too. I don't know if you can see it here. So for your neck, let's move your neck left and right. We should have done that.
Right.
Okay.
I can go right and
The
back.
other side.
But this way I
It's
can't
very
go as
stiff,
far,
yeah.
and I can't. And that.
And you feel it right in here. That's
Yeah.
what
When I
limits
go
you.
back, I feel it right going down that.
In here. Okay.
Mm-hmm.
And your neck and shoulder just happen together. The tightness happened together, or there's another event for the neck.
I don't know. I've called it rotating injury syndrome.
Mm-hmm.
It's like one
Mm-hmm.
day
Mm-hmm.
my shoulder hurts, one day my back hurts, another day my neck hurts, another day it's back to something else, and it just
You just have pain all over. Probably
Yeah, so
you
it's-
start to notice the pain that's screaming that day. You know, you have
Yeah.
issue and all of that, but probably one is aggravated than other, so your
so it's,
brain pick on the strongest signal and ignore everything else.
yeah.
Okay, so
All right.
so let's do this motion now. Look at that.
Yeah, that's better.
Yeah, can you see it? Can you feel the difference?
Yeah.
It's shaky. Yeah. Look at this. Look almost symmetrical. Yeah. Let's do the thumb up and bring it up as far as you can. All the way. How's that? Just
Good.
a little bit.
on the
Where
left.
do you feel it when you do that?
I'm feeling it right
Okay.
here and back here.
Okay, let me do this area, okay? Sorry. Let's relax.
Not yet.
Almost there.
Okay.
Yeah, we're almost there. Actually, we're gonna do that very soon. I just want to make sure to get that full range of motion here before we measure it. So you said in that area, but I just want to make sure to release this. Too much?
No,
Okay.
it's weird because some of the times you press,
Mm-hmm.
it doesn't hurt, but when
It's
I do it to myself, it hurts.
Mm-hmm.
Or my wife, it's like you massage and press hard on it, it hurts.
Because
So-
you don't have a tool. That's one thing. The other thing is not about causing the pain. We can release it without causing the pain.
Yeah,
It's about the pressure, the direction that make it not painful and actually do release. And it's instead of like just aggravating it. Does
yeah,
that make sense?
yeah.
So
So,
let's do that
Which-
again. You see how fast he did? You see how fast
Yeah.
he did it? That's nice.
yeah,
Yeah. So thumb up and bring it up. How's that? Almost there.
yeah.
Let's do the thumb up here, this way, and bring it up. You see? That's nice. Okay.
It's better, a
Yeah.
lot better.
Let's bring it back and turn around. Stand up. Okay, we're gonna take the range of motion after this. Yeah, it looks symmetrical. You see how fast he did the movement. So a sign of tightness, you were like
Yeah,
shaking because you try to stretch a band that has a knot, so you really force it to stretch it.
yeah,
But when you start to break the scar tissue, you don't have that like knot in the middle. So let's lie on your back and we're gonna take the range of motion. So that was 138, bring it back, pain free. Okay, so now is, you can see it's almost 170. 170. Okay.
And it was what?
138.
Okay, that's big.
Yeah, that's normal is 180.
Okay.
So we have a little bit work to do, but you're almost there. So you gained very easy, like 45 degrees, you know,
Yeah.
or more than 40 degrees. Abduction, how much it was?
150.
150. Okay, so
That's
we're
going
gonna
up
bring
here.
it to your ear. Okay, that's 180. Oh, did you see it? Here you go. You see that? 180 right here. Yeah. Okay. Internal rotation, how much it was?
70.
You want me going this way?
Yeah. Oh, you try to show up. it's a good. Yeah. Go ahead and do it. Yeah. Here, remember. So 170, and now. Okay. Let's see it here.
I have just 70.
Ah, 70. Sorry. You cannot do one. Sorry. I was thinking about that wrong. 80 degrees. Okay. All right. Sit up.
80?
80.
Or what
That's
do you want
normal.
like that?
And this is yeah. No.
I mean,
Oh, he's actually doing it. Okay.
my thumb was in the way.
Okay, so now let's check how much it is. Okay, his thumb was. Wow, it's 80. It's at 84. It's really beautiful. Nice. That's almost normal.
And
Sit up
this
for
way?
me.
Not that
That
way?
was normal.
Oh,
Yeah, but and tell me any pain or it's gone.
that's amazing.
You see, he's pulling.
He's able to.
He's able.
Yeah.
Before he was like not doing this
I
because.
couldn't. Oh God, I couldn't do.
Yeah.
I
No,
could
he's
not
trying
do
to show
that.
off now.
No, but I
That's
could
beautiful.
not
Look at
do
that.
that. I could
Yeah.
do it with this arm.
Yeah.
This arm I could do it, but this
Yeah.
arm I could. It would really hurt.
Yeah, let's do your range of motion again all around. Just move it around and tell me how that feels. Look at this. That's
Yeah,
beautiful.
that's incredible.
Yeah, Yes. All right.
So
so
there's still a little bit of tightness here. And
tightness,
here.
not pain,
Not.
because we still have to
There's
do
still-
more work on the scar tissue.
Yeah.
Eventually, we're gonna release everything, and that should be fine. But because you have a lot of scar tissue,
Yeah.
so it takes a little bit time to break
Right.
it. But at least you get like full range of motion.
Yeah.
You know, so you can be functioned. So it takes a few treatments to clear up everything.
Yeah.
Yeah. So what do you think about ASTR treatment?
It's great.
Yeah. Awesome. Yeah.
It's great. I mean, how long?
We just manually worked like 15, 20 minutes.
Yeah.
Yeah. Yeah.
Yeah, incredible. And I was doing all this research, reading all these different things from all over on the internet, and the one article talked about delayed onset muscle soreness. So I thought, well, what is that? So I started researching that, and then I read about soft tissue release. So what is that? And so I looked, and there's other people, I guess other techniques, and then I found you, and then I looked at yours, and yours seemed a little different, and you had all the videos. I started looking at the video, and I saw the lady with the shoulder, and I thought, oh my God, she was in a lot of pain, and the video is only 19 minutes long, and you in a few minutes she's goes to I think 160. On one of them, and then you go, oh, work a little more. Oh, there's 170. Work a little more. There's 180, and she wasn't in pain. She left in no pain, and I thought, my God, I've gone to massage for an hour. I've gone other therapies, and I don't feel better. And so I showed my wife, and she said, oh, you got to do that. And so I called up and booked an appointment as soon as I could. And you had an opening today.
Yeah, so
I didn't want to wait till next week.
yeah, I'm glad you're feeling better. Yeah,
Yeah.
so you can tell the difference.
Oh yeah,
Yeah, awesome.
yeah,
Yeah, thank you so much.
yeah. Thank you.
Thank you. Awesome. Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.